So tell me more about you and basically introduce yourself and exactly what you do.
All right. I am Annette Byman. I'm a clinical certified thermographer here in Fort Myers. And I really have a strong passion for helping both men and women, but especially women when it comes to breast health. So thermography is a test of physiology. It's kind of in a class of its own. What physiology means is we're looking at the cellular level. So we are utilizing an infrared camera that is detecting the infrared temperature that's being emitted from our skin. And that temperature range can range from hypothermic to hyperthermic. So it produces a thermal map that indicates where we have hypothermic activity, normal range activity, and hyperthermic activity. And, many times people will say, okay, so what does that really ultimately tell us? It's telling us really where a disease process is happening. I'm a really big researcher. I'm a former dental hygienist, so I have spent my whole career in a dental environment and a medical environment, and I love research and I love learning. So you'll hear me really reference a lot of statistics and a lot of research. I feel it's important to be providing really good data when I'm talking with clients. So you will hear me, like I said, reference a lot of data. One of the latest statistics that I have seen, 95% of cancers, not one specific cancer, cancers as a whole, have one common theme, and it's inflammation. A thermal mapping is going to show us that exactly. So we're able to then identify where people really need to focus their healing journey to really get to the root cause of what's causing that inflammation and starting that disease process.
Oh, I had conceived this as being exclusively a conversation about breast health and thermography as an alternative to mammograms, and didn't conceive that this is a whole body.
It's whole body. Of course, I see both men and women as clients. My men as a whole will come in for a full body, right? So full body, I'm talking head to the bottom of your feet. It's encompassing every single part of your body. That is what the majority of men that I see will want when it comes to thermography. Women, it will vary. I, of course, will have some women who do want a full body. There's a certain type of thermogram that I really am a big proponent on called the Women's Health Check, that really focuses a little differently on items than the full body thermogram does, but it's another option. And the most prevalent is breast thermography. I would say my largest population group there is women who are specifically wanting just the breast region. But no, it's absolutely the whole body.
That's incredible. I can't even imagine, because I know, typically when it comes to inflammation and pain, there's definitely usually like a warmth associated with it. And so that just makes so much sense to me, but I never made those connections before, and that's really incredible. But still, we will start with the thermography as an alternative to the mammogram and discuss the differences between them, I guess. And if you have statistics to share about mammograms, I would love that.
Sure. So mammograms are definitely a breast option, right? You also have ultrasounds, CT scans, MRIs, but I would say the medical world considers mammograms as their golden standard. Okay. Thermography, like I mentioned earlier, is really in a class of itself because it's a test of physiology. All those others are a test of structure. They need a structure to be able to identify what is happening. So it's common for the traditional medical world to recommend a mammogram as the first step. Now, there are different reasons why people are not good candidates for mammograms. If you are wanting to be cognizant of your radiation exposure, thermography is a great option because ultrasound and MRI and thermography are the 3 testing modalities that are radiation free. But your mammograms and your CT scans are going to produce radiation. So anybody who's looking for an option that does not produce radiation, like I said, thermography, MRI, and an ultrasound are their options. Women who have dense breasts, research shows time and time again, a mammogram does not have the capability to accurately diagnose with dense breasts. And I'm here to tell you, a lot of women have dense breasts. There are also times when women have breast implants. So once again, a mammogram isn't really the best option for them. Thermography is. Like, there really is not anything I can say that would disclude somebody from thermography. As long as they've gone through puberty, and so I typically say, ideally, maybe around the age of 20 is when you're a good age moving onward for thermography, but otherwise there's no restrictions. It truly is a no radiation, painless, no compression. I always tell my clients it's the easiest medical test you're going to have. You literally, especially for a breast thermogram, you're just sitting there comfortably and letting me do what I need to do behind the scenes. So, mammography is going to be the golden standard. I've seen that time and time again, but it's not the only testing modality. And that's one of the biggest messages I want both men aren't a candidate when it comes to mammography, right? But yet the reality is we have 1,200 men each year who are diagnosed with breast cancer. And unfortunately, their breast cancer typically isn't diagnosed until later stages because they're not candidates for mammograms. So once again, this is where thermography is a fabulous alternative choice for them. But there are other options besides mammogram. And I guess that's one of the biggest messages I want women to really understand is you do have options based upon what's important to you. Yeah.
So obviously everyone has different priorities when it comes to their health, when it comes to risk factors, when it comes to all these different variables associated with getting a mammogram. What are some of those like common misconceptions or concerns that people might have that would make them not choose a mammogram?
Dense breasts, number one. Breast implants, I would say, is also another close one. I see a lot of women, right, who have chosen to have the breast implants, and obviously it's very important they need to be having a regular annual check just as well as anybody else. Women who have very large breasts, many times a mammogram is not able to capture the borders. So I would say those are probably the top 3, right? And then, of course, just as our society is becoming more health conscious, we're realizing we need to be making more mindful choices of what we're exposing our body to. So women are really, I'd say, becoming a whole lot more health preventative when it comes to reducing radiation exposure. And it's not that I'm not in support of mammograms. For many years, I had mammograms, but it wasn't until I really started to understand that I had other options and realized the cumulative effect of what happens with radiation. Radiation, it's a cumulative effect, and it's really hard to detox from our body. It's not an easy thing to just eliminate. So I think both men and women, we all need to be smart about how much we're really exposing our body to when it comes to radiation. So like I said, once again, thermography, no radiation at all.
Interesting. Okay. So moving beyond the mammogram, what are some issues that you've been able to pinpoint inside people's bodies using thermography?
So thermography really, once again, is targeting changes that happen at that cellular level. We're talking a whole host of starting from, if we're looking at the head and the neck region, dental issues, inflammation, periodontal issues, sinuses, thyroid, carotid artery. As we move down into the body, the lymphatic system is huge. The lymphatic system is really, I'm going to interject for a minute here, but the lymphatic system is so important that's like the toxic remover in our bodies. So if we don't have a good flowing lymphatic system, oh my gosh, we're really creating a disease environment in our bodies. And I can tell you, every client I see, almost every client I see, has a lymph congestion. It's huge. It is huge. We are all battling it. And I think that's probably one of the most surprising pieces when people see the results of their thermogram is how many areas they have identified lymph congestion and lymph challenges. So the lymph system is really important. Of course, the breast health, anything that has to do with the gastrointestinal system, the reproductive system. When we look at the extremities and the arms, the hands, the feet, we're talking arthritic, we're talking neuropathies, we're talking autoimmune diseases. It truly is giving us such an incredible picture of all of the processes of our body and really identifying where we've got some health challenges already happening. So here's another statistic that I love to share. If we take a look at just breast cancer, because that's really what I would say is my passion, is really getting the message out to men and women about breast health. So a lot of my research really focuses more on breast cancer than it does other cancers of the body. Research shows that it typically takes about a 5 to 10 year period for a mass to develop into a cancerous situation in the breast region. 5 to 10 years. A thermogram is identifying when it's beginning, right? So once again, we're getting to that cellular level. We're identifying a change that's happening in the cell years before it truly turns into a cancerous situation.
That's incredible. And it's very interesting also because I wonder, why have I not heard about thermography? I just feel like I'm just going to take your business cards and just make it rain all over Southwest Florida.
I would love for you to do that.
There are so many people that work proactively on helping people identify their areas and causes of inflammation. And if someone were able to literally, I can't tell you how many times I have told my chiropractor and my nutritionist, I'm going to stop eating so much sugar. I'm going to get rid of gluten. I know for my body, they're not good, and if I would have been able to see inside, because I know where my pain is, but if I'd have been able to see it on something and be like, no, Amber, you're hurting yourself when you have these things in your body, how impactful would that be for me, for anybody?
Exactly.
To be able to see that, this is what this is doing. And then, our thermograms, is that you call them? Are thermograms expensive?
No, they're not. They really aren't. A full body in our office is $450. A women's health check and a half body is $360. And a breast is $185. Okay, now, let me preface by saying not all insurance companies will reimburse for a thermogram. I always encourage my clients to submit it to their insurance company anyways. There are insurance companies that have, but there need to be more of them. And my whole goal with encouraging my clients to submit is I'm hoping eventually, as these insurance companies are seeing more and more thermograms coming through, they're going to start covering for them. The other thing that I really, if we just are really being honest and really look at every other thing that us, especially women, do and compare it to what that cost of a thermogram is, mean, Amber, take a look at what us women spend our money on. Our hair, highlighting, coloring our hair. Botox, our eyelash extensions, our brows, our lip fillers, tattoos. I mean, the list goes on. Manicures, pedicures, I mean, the list goes on and on. Think of the money that we're spending on those pieces to make ourselves look better and compare it to what the true cost of spending less than $500 on a year for a full body.
To understand and...
Exactly, to really understand what's happening inside. Because I think anybody who's gone through a cancer journey or a disease journey will say, if you don't have your health, what do you really have? I mean, that's the reality of it. So all the things we're doing out here, does it really matter if we're not truly healthy and living a really good, productive life? So I many times like to put that out there to my clients to really get the wheels turning of, what's really important.
So let me ask you, when it comes to people that are battling cancer or people in remission from cancer, to what extent are thermograms leveraged currently in traditional medicine for pinpointing where that inflammation is?
Yeah, so unfortunately, I run into this on the daily, and I really am hoping that myself and other thermographers across the world are going to be able to really help shift the perspective. Traditional medicine does not look favorably on thermograms. Most of them do not. And I want to give them the benefit of the doubt in saying perhaps the reason they don't is because they were really never taught it in medical school. They were not exposed to truly the accuracy and the true multiple facets of what thermography can really identify. Thermography really came about back in like the 1950s. The military is the one who really utilized it. And they used it kind of what I call like their night vision tactic, because once again, thermography detects heat. So they were able to determine based on heat if there was recent movement. So the military was really the first, I believe, to really utilize thermography. But over the decades, just like most technologies have really advanced, so has thermography. And it has a proven record in the health of the body, in recognizing, like I said, early cellular changes. There just hasn't been a lot of research on it and uncensored research on it. But when I take a look at the research that I have been able to get my hands on, when you are looking at sensitivity and specificity, thermograms are at a 90% rate. So sensitivity, what that means is how accurate is it in diagnosing cancer? Specificity is how accurate is it in detecting no cancer? So it's falling at 90-ish%. Mammograms, from the information that I have found, fall in your 80 to 90%. And I think part of the reason mammograms aren't quite where thermograms are has to do with, as an example, dense breasts, because it doesn't have the ability to be as accurate with dense breasts as a non-dense breast. So the sensitivity and the specificity is there. It's just our traditional medical world doesn't have the information and the knowledge on it to really recommend it.
Interesting. I find all the time, honestly, I think it's just a thing, that there is this, it's either or. It's either traditional medicine or it's holistic wellness, and they cannot coexist. Do you see at some point a world where that does, and where do you think thermography can have an impact inside traditional medicine?
Yeah. Amber, it's already happening. In fact, once again, our research is showing us that the best outcome now I'm talking breast cancer here. It probably does follow other cancers, but this is specific to this research is specific to breast cancer. Utilizing alternative and traditional modalities together give a higher percentage of remission. And we do have medical doctors who have taken the path of alternative care, who are providing natural modalities to cancers, not just breast, but all types of cancer. So yes, we're seeing more and more of the mirroring, of the bringing together the two of them, because it really is showing the better outcome. Yeah. We need more of it, but it is happening. If you do some Googling and some research, and we have some sources here in Florida. Yeah.
That's incredible.
It is.
I look forward to more traditional medical doctors and medical practitioners embracing these sorts of aspects, because I think ultimately what ties practitioners together is the desire for people to live well, regardless of the infrastructure. So I really look forward to, instead of it being written off, it just being like, maybe I'll get curious about this and see what it could do for my patient, especially for those in, battling cancer or diagnosing cancer or anything like that. Because I know a couple of people personally, from breast cancer to ovarian cancer to, a lot of different ones, to lymphoma. And I feel like, I don't know, obviously, but it just seems like, thermography at some point or any point in that journey might be helpful.
Absolutely. And just what you're saying, I have to agree. I mean, Amber, we're all so individualistic. There is no one true pathway for absolutely every person to take to get the same outcome. What might work for me may totally not work for you. So it is important for patients to take a look at their alternatives. And that's one of my biggest messages. I want to empower people to know that they have to be their own advocate. They have to do their own research. And there are a variety of different pathways you can take to heal yourself. But really, I believe getting to the root cause is really where it needs to happen. So I'm big into alternative care. Yes, there's definitely a place for traditional medicine. That, I will definitely say there is. But I really think people just don't realize the options that they have.
Yeah.
Yeah.
Who primarily right now do you work with from a practitioner standpoint to help people find you?
I have recently started working with a chiropractor. Dr. Jared Ward and I have had some good conversations.
That's great.
I really believe that he's so knowledgeable. He's really been blessed and gifted in a lot of ways. He is one entity that I've used. I have other practitioners that work in the center that I work with. I have
and you can name that center just for the record.
So I provide my services at a holistic center called AHA, a Holistic Approach Center. It's located right here in Fort Myers. We have a number of phenomenal practitioners in our center. I work with Karen, who is a massage therapist. She specializes in lymph massage and craniosacral massage. She's a nurse by profession, extremely knowledgeable. I work with a PT, Nika is her name, physical therapy and acupuncture. She is phenomenal. She's very well respected in her field. I work with a psychotherapist whose name is Dorothy. Quantum energetics, both Lori and Cindy in our practice are phenomenal there. So, I have just within my own center that I'm working in, some incredible credible practitioners. And so we all have the ability to work together. And like I said, outside of the center right now, currently chiropractic practitioners.
That's awesome. It's good to know that even though the large majority of people are, inside with traditional medical doctors, that there are still avenues where you're finding people now. And then, maybe that opens up as people start to see what kind of results places like AHA can fetch. So how does it work when someone, one of those people refers someone to you, you do the thermogram? Walk me through that process front to back with a patient, and maybe more specifically, give me a part of a success story that someone might have if theoretically they visited AHA.
Oh, and I've got a number of them, but I'm going to probably use one of my most recent from 2025. So I have a client who has been seeing me for the last 4-ish years for thermography, in particular for breast thermography. She was a former breast cancer survivor, had thermograms that were coming back in the low risk range for several years, came back in 2024 saying, you know what, I want to come in sooner than my annual because I'm noticing some changes in the breast that I previous had cancer in. And that thermogram did come back at high risk. So there definitely was a reoccurrence that have happened. She had taken the traditional medical route, meaning chemotherapy and radiation the first time around. And for her, it really just produced an environment where she struggled getting her immune system back. It was really rough on her. And so she, from the get-go of getting that report back, showing that we had some new activity, said, I don't want to go traditional route this time. I want to do everything alternative and holistically. And so I partnered her up with different practitioners in our arena. We also have other modalities. We have an infrared sauna. We really talk to our clients about diet changes and lifestyle changes because those are huge. Removing sugar from the diet, processed food, alcohol, and really focusing on, oxygen therapies, IV therapies, infrared saunas. Those are just some of the modalities that really can make a huge impact on healing the body. And so she incorporated a lot of those modalities into her lifestyle. And within a 3 to 4 month period, we were thermogramming. This was her request. She wanted thermograms done every couple months. And Amber, within a 4-month period, she was able to move that high risk back down into a low risk situation. It's amazing how quick our bodies can heal when we give it what it needs. So she's not the only success story that I have of somebody who has been able to move their breast cancer diagnosis back down and really truly bring it into a low risk or moderate risk situation. So that's just one example.
That's incredible. I love that. I think cancer is something deeply personal to everyone. And I feel like these days with the statistics surrounding cancer, there's very few people whose lives it hasn't touched and who, might have lost a loved one to it. So it's very encouraging to consider that there might be therapies that can really proactively pinpoint risks.
And thermography, like I said, we need to start really shouting it from the rooftops because, once again, statistics are showing one in every 2 people will experience cancer, okay? One of the two of us will. I thankfully have never had a cancer scare. I don't know if you have or not, but if we're using statistics, right, one
It's
of
time
the
for
two of us are
for a thermogram.
going to be exposed to it, unfortunately. We're seeing spikes in children, young adults. Research is showing, the really rare cancers from decades ago are now no longer considered rare. They're becoming more common. We're seeing that happen more frequently. So, our poor bodies are just being bombarded with toxics, chemicals, bad food choices. Like, we really have to be smart about what we're doing with our bodies and the environments that we're placing our bodies in. So, yeah, you're right on. You're 100% right on target. And the sooner you can identify any disease process or cancer, right, the better the prognosis.
Yeah. It's so interesting to conceive that we're in, a more toxic world than we've ever been in. And there is verified data that says that cancer is caused by inflammation.
Yes.
And somehow these dots are not connecting.
Right.
How wild.
I know it. Yeah. The alternative medical world has really had its challenges. Okay. Yeah, we really have. But people are really becoming, like I said, wiser. They're becoming more health conscious. They're really starting to pay attention. And once again, there are just so many other options for people to consider. And I really, truly believe it should be an individual choice. I just think most of us lead such hectic, stress-filled lives that we really don't even know how to really sit quietly and let our intuition tell us what's best for us. But if you can do that, I really think you can choose the right pathway that's going to heal you. But once again, there's not one pathway that heals everybody. It's really, truly individualistic. So, yeah, just want people to know you have lots of options. Lots of options.
So I would like to get a little bit of info from you on men's health, what success you've had with men, what are different things that you've pinpointed beyond, obviously breast cancer is still a concern for men too. What other things have you found in men, and what are the stories surrounding those things?
Believe it or not, many times people think thyroid issues are predominantly found in women. You'd be very surprised how many men also are struggling with thyroid issues. So I do see thyroid as being a health challenge for men, cardiovascular, heart-related, autoimmune, and neuropathy is big. Neuropathy, I do have to say, women, we see it too, but I'd have to say men and I don't have a causation there, to be honest, but men seem to have neuropathy, diabetic issues, and varicosities. Believe it or not, varicose veins are also a common discovery when we're doing men's thermography. So there's not just one or two things, Amber. There really are a varying degree. Now, I will say, for as wonderful as thermography is at detecting and recognizing disease processes, there's really three parts of the body that it's not specific enough to do anything with. The brain is one of them, and then the prostate and the testicles. So for men, we're not able to help in that department, right? But the rest of the body, yeah, we can really identify a lot of those other issues.
That's amazing. So do you have some success stories from men that you have helped them with issues or pinpointed issues for them?
Yeah, not as much as I do for women, to be honest with you. I don't have men come back on a regular basis. Like for women, if they do a women's health check or a full body, unless there's something that's really concerning to them, I really don't recommend that they need to come back every so months or annually, unless, like I said, there's something really targeted that we really want to follow and make sure we're seeing improvement with. But for every woman, I personally recommend an annual thermogram, right, for the breast. So I'm seeing women coming back on the regular. I don't see that with my men. So unless they specifically reach out and give me a success story, I'm not hearing it like I do with the women's success stories.
Yeah. So going back then to some of the issues that you have identified with men, specifically, I want to touch on the cardiovascular one. I think this given our diets, given our lack of movement, our I don't want to say minimal detoxification efforts, but we don't really sweat as much as we used to, and these types of things. What can you connect there as far as thermograms when it comes to men's cardiac health? And then where can it go from there as far as recommendations, and how early on can you pinpoint something?
Yeah, the vascular system can really be identified fairly easily with the thermogram. So we're able to tell men if there's suspicion of carotid blockages anywhere. They're able to identify what's called angiogenesis, where the blood vessels put out new capillary growth to keep a tumor or a mass alive and growing. We're able to identify factors that will encourage a man to do further blood testing, find out what their CRP levels are at, find out where are they sitting when it comes to cholesterol levels and your HDLs and your LDLs. So I would say, cardiovascular-wise, it's really helping encourage men to do more diagnostic when it comes to lab testing.
That's awesome. That's good. Because I think for men in general, I feel like they have, the men, if there are any men listening to this, they'll have to forgive me. But I feel like they have a more reactive approach to their health. Women are very kind of on it when it comes to like checking all those boxes and getting the things checked. And I think there's more promotion for them to do that, with the big awareness around breast cancer, where men, aren't as apt to be so proactive about it. And I think something like a thermogram is so helpful for them to get, on, a fairly regular basis, so they can see, do I need to get these blood tests done? Do I need to see someone else about these types of things? Or, my wife's been on me about my diet, and here's what my thermogram says. Maybe I do need to listen to her and cut back on the alcohol or the, red meat or, whatever it is.
Exactly. Yeah. Yeah. It's kind of like, it's like a good radar to really help men really focus on certain areas. Yeah. And I think you're right. I mean, I take a look at my husband. I have 3 sons. I take a look at the men in my life. It's not until many times something catastrophic happens before they really take action. I think I don't know but their mindset, I just don't think goes to the mindset that us women have, where we're being perhaps more proactive in wanting to really understand and identify what's happening to us.
Yeah. I wonder a little bit if it's not sort of like the macho stereotype of power through, be a man,
exactly.
I'm fine sort of thing.
Exactly. Yeah.
Very interesting.
I think there's a lot to that.
Yeah, 100%.
Yeah, there really is. Yep.
There is a woman that is sitting across from you. She's not me, but it's just, she's theoretical. And she is in pain and she's struggling, and she is, if our wellness is a spectrum, and we know maybe a little more, but she's on the other side of that spectrum, and she hasn't started, and she knows she's in pain, and she knows inside something doesn't feel right. What would you say to her to encourage her to get a thermogram with you?
I would really start by helping her understand that there is a relatively simple test that she can choose to have, which is thermography, that can really help identify the direction of what's happening with her body internally. So many times we don't even understand where the root cause is that's producing these different symptoms that we're experiencing. And so just because you have an ache or pain in one part of the body, really, truly, the root cause could be happening somewhere else in the body. So I would really, help as much as I had the ability to help her understand that thermography is really going to give us a clear picture, once again, of what's happening internally with the temperatures that is happening in our body, because inflammation is the true precursor to a disease process and to a cancer situation. Yeah, so I guess I would just start by helping her understand you don't have to spend thousands of dollars. You don't. Here's another great thing about thermography. You don't need a doctor's order. You can self-refer yourself. So many other medical tests, you need to have a referral. A doctor has to believe you need that test in order for you to be tested, not thermography. No. So that's another beauty of the thermography world. Yeah. Being able to make that choice on your own and as often as you want.
Hopefully it stays like that once everyone catches wind of how helpful thermography is.
Yeah.
I want to ask you one more question. It wasn't really on my radar until you just said that. What is your perception of the structure of health insurance and how it approaches wellness? And
oh, yeah, that's a tough question. Having been a dental hygienist my whole working career, being exposed to dental coverage for patients over the years. Unfortunately, I learned through my dental experience, and it translates to medical insurance as well. Unfortunately, there's still too many people who feel and have the philosophy of, if my medical insurance doesn't cover it, it's not necessary. And that couldn't be further from the truth. Insurance is not specific to one individual. There are many procedures that are very beneficial that are not covered by insurance. So if there's a message I can put out to the mass, it is to not succumb to that thinking that just because your insurance doesn't cover it, that it's not needed or necessary. It's not true. I have a few other things that might be
please talk as much
helpful and informational. So every time I have a client come in to see me, I have this little, I guess they're called rack cards. And the front side of it just gives simple instructions on how a woman can perform a monthly breast exam. You would probably be amazed how many women do not do this. There are,
I'm 41 also.
Yeah. It's really interesting how many women are not comfortable really looking at their bodies or touching their bodies. And seriously, I like so many clients, when I start talking about this, they're like, yeah, I'm just not comfortable doing that. And when I really ask the hard questions, many times what I hear women say is, yeah, but I'm scared to find something. Like, so if I just don't do it.
It doesn't exist?
Exactly. Which I get it, right? But really, once again, I want to bring both men and women back to the reality that the sooner you can find something happening, the sooner you can treat it, which means most of the time, the best outcome. So I really encourage women to do, and it's easy to do. The little steps that I have are so easy to do. But basically, every morning when you're getting dressed, also just in front of your mirror, put your hands up above your head, put your hands behind your back. Just really take a close look at your body, not just with the breasts, but any moles or any rashes or any changes that are happening, right? So valuable in being able to get you on a journey to bring you back to health. And then on the back side of the card, I give just some really helpful tips and tricks of what we can do to keep our bodies healthy. One of my, I think, better discoveries over the years has been the Yucca app. And do you know what the Yucca app is?
Literally 2 interviews ago, someone was just talking.
Someone talked about it. I love the Yucca app. So easy to download on your phone. Anything that, and I shouldn't say anything because I have truly run across a couple products that haven't been tested by Yucca yet, but for the vast majority, a lot of our food products, a lot of our cosmetics, our perfumes, our lotions, our deodorants, I mean, the list is extensive, but it's a matter of just scanning the barcode and it giving you a rating of 1 to 100 of how clean that product is. That's huge. Of course, in my field, I talked earlier about how important the lymph system is for clearing out the toxins of our body and how so many of us truly struggle with lymph congestion and lymphatic problems. Deodorants is one category of products that I really encourage my clients to find a really good, clean deodorant. That Yucca app has amazed me time and time again as really identifying the good and the bad deodorants to use. I personally make my own now. I mean, so there's those options. But the Yucca app I've just been a phenomenal game changer in my own life, and it's one that I really share with a lot of my clients. But also, just other really good, healthy lifestyle habits that doing some type of exercise every day for a good 20 minutes. Here's another one that I share with women. Really ditching the bra and sports bras as much as you can. Research really shows they contribute to lymph congestion, right? They're constricting, they're holding in the heat. So one medical doctor who really over the years specialized in breast cancer was Dr. Ben Johnson, and he has now passed away, but I've researched him, I've read his books, I still utilize a lot of the information that he gathered with his research. He was one of those doctors who said, women, if you're wearing a cup size of an A or a B, you shouldn't even be wearing a bra. You can go braless. But I think in today's world, especially with sports bras, especially in the younger population, if they just knew that really it's not the healthiest for your body, and to really minimize that. I have clients who will tell me, I wear it 24 hours a day. I sleep with it. From the minute, they're wearing it from the minute they get out of the shower, it gets put back on. So just, helpful hints like that really can make a difference in the health of your body and truly just give you better breast health and overall health. So yeah, I've got a number of different things that I talk with my clients about. But once again, I just say, really, knowledge is powerful. The more we can educate ourselves, the more we can be just really good learners and get out there. And yeah, Google can have its pros and its cons, but just being willing to be open to doing your own research and talking with other people in different modalities and different specialties. The more we know, the better we can live a healthier life, heal ourselves, and help our loved ones.
Oh, you killed it. And it's literally 1:31. Yeah.
Gosh. Okay, that went fast, Amber.